Hello friends, today we are going to discuss about correctional mental health. I am Dr. Suresh Bada, Professor of Psychiatry working at NIMANS, Bangalore. Before I start my presentation, I'd like to place this disclaimer. This presentation is for academic and training purpose only. This is not a substitute for professional legal opinion. For clinical opinion, please do contact a psychiatrist. For legal opinion, please do contact an advocate. Conflict of interest? None. In this video, I'm going to discuss about correctional mental health, also called as correctional psychiatry, the prevalence of mental illness in prison setting, and I'll be discussing about Bangalore prison study and the way forward, that is the conclusion. This video is targeted for doctors and psychiatrists, nurses who are working in prison setting, mental health professionals, criminology professionals, prison or correctional officers working in observational home such as juvenile home who are looking after children in conflict with law, advocates, judicial officers, and any custodial settings where the mental illness is almost similar to prison. Let's discuss about correctional facility. Correctional facility means a place where people accused or convicted are kept when they have been arrested or being punished for a crime by the state. They are also called as judicial settings. Let's understand how this prison or correctional settings came into existence. It's a long journey from reactive to proactive. That means initial days, if a crime is committed, the state used to punish them as a revenge. That means a person has committed a crime so that he needs to be punished. That is a revenge. That was the attitude. Slowly over a period of time, it became a deterrence. That means if a person has committed a crime, so he needs to be punished in public so that the public at large comes to know the crime is not tolerated in a society. But over a period of time, in a welfare society, it's the reformation and rehabilitation took precedence. Here, a person who has committed a crime is considered because of the society, because of various other reasons, he is in conflict with law. Hence, the welfare society thought of converting him by reformation or else by rehabilitation. So, at present, in this presentation, I'll be focusing more of from rehabilitation and reformative process. Let's understand about correctional setting and mental illness. Mental illness and correctional settings are highly interdependent, and also there is an intricacy dynamic between both the dimensions. Let's understand about correctional settings and how mental illness is presented. If you look at the x-axis as a duration, and mental illness can occur either during the commission of crime or else before the commission of crime or else during incarceration, that is when they are inside the prison, or else after the post release. So the mental illness can occur anytime, before, during inside the prison and post release. Let's discuss about the prevalence of mental illness in correctional settings, that is prison. The first study I would like to discuss is Rajasthan prison study. A study was conducted in one of the central prisons of Rajasthan. Here, 118 prisoners were evaluated, and they came to know 6.7% of the prisoners had psychotic illness, depression was in 16%, anxiety disorder was in 8%. However, the substance use dominated. Here, they were able to find 58% of them were using alcohol or drugs before the commission of crime. This was the study published in Indian Journal of Psychiatry. Similarly, another study was done in Kerala. It was a sample size of 255 prisoners. And in that study, it also said that 68% had mental illness. And substance use was the most common, that is around 47%. Antisocial personality disorder was 19%. That means they're all psychopaths or else dissocial personality disorder. Adjustment disorder was seen in 13%, mood disorder 4%, and psychosis was 6.3%. This study is also similar to Rajasthan study, and it was published in 2014 in Indian Journal of Psychiatry. Coming to Punjab prison study, also did a study in which 500 convicted prisoners were evaluated. In that, they said that 23% of the convicted prisoners were suffering from psychiatric illness, excluding substance use. That means if you remove alcohol or drug abuse, still 20% of them have one or the other mental illness. But however, the international scenario also reflects similar finding. There was a meta-analysis done by Fazal and Danish in 2002, published in Lancet. In that study, they did a systematic review of 62 studies and involving 12 countries, involving 22,790 prisoners. In that study also, they said that there is a high prevalence of mental illness in prison population. And they said that point prevalence is somewhere around 40 to 70%, depending upon whether alcohol, tobacco use, other drug abuse were assessed or not. That means if you take comprehensively the mental illness, it is around 70%. By removing drug abuse, alcohol abuse, or tobacco abuse, it will fall somewhere around 20 to 40%. This is what the international scenario says. Let's discuss about reasons for increased mental health morbidity inside the prison. Let's understand the university of crime. A person who is involved in petty crime is arrested. It may be because of very social reason. He is arrested, taken to the prison. There is no rehabilitation inside the prison. This person, during his stay inside the prison, will come in contact with various organized criminals. I would rather call them as sociopaths or psychopaths. They will train them because this person is not doing anything inside the prison. Hence, he is not being rehabilitated, and he will be rehabilitated by these organized criminals. Once he is released into the community, he will have stigma, he will not get any job, and of course, social reasons. He will again enter into organized crime because of the contact he has got inside the prison. Hence, I would rather say, if the prison doesn't have any rehabilitation, it will become a university of crime. A petty criminal will become an organized criminal. Or else, if you want to stop that, we need to start rehabilitation inside the prison at the earliest. That is the need of the hour. Moving further, mental illness and prison. What is the nexus? There are many people with mental illness may end up in conflict with law because of aggression, violence, domestic violence, sexual violence, creating public nuisance, substance use. For these reasons, they will be arrested. Once inside the prison, if there is no mental health rehabilitation, further his mental illness may worsen, or else depression may start. If a pre-existing mental illness is there, it will be relapsed, or else if he is highly vulnerable to develop a mental illness, that means a mental illness can develop inside the prison also. And once he is released, if there is no continuity of care outside the prison, that means his mental illness further worsens. That means again he may re-offend, or else he may again get in conflict with law. Hence he will be again re-arrested. That is how mental illness and crime, they go hand in hand. Let's understand the process clearly. As I mentioned earlier, the mental illness can be during the commission of crime, or else before the commission of crime, or else during the incarceration, or else post-release. In any of this stage, the person may develop mental illness. Let's discuss each one of them. If the mental illness is there before the commission of crime or during the commission of crime, there is high possibility a person with mental illness may commit a crime, or else may be involved in conflict with law. Those are all severe mental illness people. The person who is using substances, personality disorders, or any other mental illness people may be in conflict with law. There is a high possibility and probability they will be arrested. If there is no treatment available in the community or else in the mental health institutions. That is the biggest challenge. During the imprisonment, that means when they are inside the prison, because of the stress, because of overcrowding, because of delay in the cases, the person's mental illness may relapse. If he is vulnerable, a mental illness can be precipitated. Because of the stress, he will start using substance use inside the prison. Delayed trial, endless proceedings, postponement, costly litigation process. The amount of money to be paid to the advocate will decide the justice, injustice, bail rejection, punishment, stigma and discrimination outside the prison, violence inside the prison, sexual abuse inside the prison will all lead to increased mental health morbidity inside the prison. Further, after the release, the family, friends, and the society will reject them. They will not get any job. Absence of community mental health care will lead to relapse of mental illness. Post-release rehabilitation, if it is not available, again mental illness will be relapsed. Non-availability of treatment inside the community will create one more problem, and relapse of mental illness is guaranteed. Hence, the prison need to play a rehabilitative and reformative process. Let's understand the mental health care. The mental health care should be available easily and accessible in the community. So a person with mental illness will not involve in conflict with law. Or else the institutional care should be available. A person who is having severe mental illness need to be admitted and treated at the earliest. The law should enable. The law should not come in the way of his treatment. If there is no community care, if there is no hospital care, that means he will involve in the conflict with law and he will be arrested. One of the classical law is Penrose law. Lionel Penrose had depicted or else put forwarded this law called as Penrose law. According to him, he has said that the population of prison is inversely proportional to the population of mental asylum. That means if the mental hospitals are less and the population of mental hospital is less, that means prison population will be more. That means more mentally ill will be involved in conflict with law and they will be arrested. This is the commonest scenario which is seen across the world. Now, keeping this in mind, a study was proposed. It was proposed by National Institute of Mental Health and Neuroscience, Bangalore. And that study was called as Mental Health and Substance Abuse Problems in Prison, the Bangalore Prison Mental Health Study, Local Lessons for National Action. This was a landmark study and the reports which are available online. This study was funded by Karnataka State Legal Service Authority. I was one of the researchers. The other researchers are Professor Pratima Murthy, Dr. Rajni Parsarthi, Professor Naveen Kumar, and Dr. Madhusudan. As I mentioned, this study was funded by Karnataka State Legal Service Authority and backed by High Court of Karnataka. Further, the Department of Prison was closely involved in the study. There was a consultants expert committee was formed to see whether there is any ethics violation, and also the study was very well planned. What was the need of this Bangalore prison study? The main objective of this Bangalore prison study was to assess the mental health morbidity inside the prison and also to plan for mental health rehabilitation inside the prison. With these two objectives, the study protocol was submitted to State Legal Service Authority, High Court of Karnataka, Prison Department, and NIMAN's Ethics Committee. The study was discussed, deliberated, modified, and approval was taken. To remind you, this study was funded by Karnataka State Legal Service Authority. Each step of the study was monitored and tweaked. This study was done in Central Prison, Bangalore. This study had three important phases: Phase 1, 2, and 3. Phase 1 was to know the mental health morbidity inside the prison. Phase 2 was to train the prison staff in identifying, providing psychological first aid, and referral. Along with that, assessment of mental health morbidity in prison staff was also done. In the phase 3, it was the drafting of guidelines and dissemination of workshop. If you look at the 3 phases, the challenging was phase 1. Here, the assessment of prisoners was done, both under trial prisoner and convicted prisoner. There were in total 5,024 prisoners. Along with that, random anonymous urine screening of the prisoners was done. During the screening of urine, the study was monitored closely so that there is no violation of human rights of the prisoners. Once the urine screening was completed, mental health training of prison staff was initiated. During the training process, the researchers came to know there is a huge mental health morbidity inside the prison staff. That means prison staff were undergoing stress and also had mental health morbidity. During the study, one of the prison staff committed suicide. That means there was a need to do the assessment of mental health for the prison staff. The study was immediately amended, approval was taken, and assessment of mental health morbidity of the prison staff was also done. In the phase 3, the guidelines were developed and workshop was conducted for dissemination. If you look at the assessments were socio-demographic detail, lifestyle questionnaire, audit questionnaire was administered, mini international for neuropsychiatric interview was also done, needs assessment questionnaire was conducted, general health checkup was also done. This study was inaugurated by the governor of Karnataka during that time. The procedure was very cumbersome. The reason being is there were 5,024 prisoners. Every day, 30 to 40 prisoners were granted bail and 30 to 40 prisoners were arrested and brought to the prison. That means the prison population was highly volatile. It was difficult to plan the study because the study was planned over a period of 1 year. That means imagine in such a highly floating population, how will you fix the number of people who are going to be assessed? Hence, the researchers were hired and trained in NIMANS, and the study was planned and executed from one barrack to another barrack. And also, the rigorous training of the researcher was conducted, interrogator reliability was done, and further, any positive diagnosis was cross-verified by the prison psychiatrist, that is, Dr. Rajni Partharthi. And all the tools which were used were translated in Kannada and back translated in English. And it was certified. Once this Kannada translated tool was administered to the prisoners and also the prison staff, the data was collected and analyzed. In the phase 1, the researchers were hired and rigorously trained at NIMANS, Bangalore. The training occurred over a period of 1 to 2 months, and they were sent to prison for data collection. The data collection was started after taking written informed consent by the prisoners. There are few refused to give consent, and they were not included in the assessment. However, the study was planned in such a way the assessment was done from one barrack to another barrack. The reason being is the prison population was highly volatile and floating population was very high. As I mentioned earlier, 30 to 40 prisoners were released on bail, and at the same time 30 to 40 were arrested and brought to the prison. Hence, the study was executed by completing the assessment from one barrack to another. Each assessment lasted approximately from 60 to 90 minutes. A research room was allocated inside the prison, and the prisoners were brought for the assessment. During the assessment, none of the prison staff were involved, either in the data collection, either in the data entry, or in the analysis. It was completely done by NIMANS researchers and NIMANS faculty. Every positive case of the prisoner was cross-verified by the prison psychiatrist, that is, Dr. Rajni Partharthi. The whole study took 11 months for completing the assessment of prisoners. Again, in the phase 1, the urine analysis was also done, which was done by random sampling, going to the random barrack, and after visiting the barrack, the prisoners were asked to give urine, and which was anonymous. Health camps were conducted inside the prison barrack, and general physical examination was also done. This is how the prison barrack looked and the study was conducted. NIMANS researchers, NIMANS faculty, and other team members conducted health camp inside the prison. Actually, these health camps were conducted in each barrack of the prison. When the health camp was conducted, there was active participation by both the prison staff and also prisoners. You can see in the photograph, there are many prisoners voluntarily came for health checkup. Many of our doctors and also the researchers participated. And also, each step of these health checkup was monitored and done inside the barrack in front of all prisoners so that no human rights violation is done. In the phase 2, prison staff training started. During the training, as I mentioned earlier, there was a lot of mental health morbidity was seen. Hence, the assessment of mental health morbidity in prison staff was also done. Before doing it, the amendment for protocol was also done. Approximately 200 staff were trained both in Central Prison Bangalore and also in Mysore. At the same time, we realized to provide care for 5,000 and odd prisoners, having 6 to 7 medical staff was very short-staffed. Hence, the decision was taken to train the volunteers in the prison population. There were many educated prisoners who wanted to contribute for the study. Hence, these prison inmates were trained in identifying mental illness, providing first aid, psychological first aid to them. Here, you can see in the photograph, the prison staff undergoing training by Dr. Rajini Parthasarathy. There is a group discussion occurring in the young prison staff. Audiovisual modes were also used for training. And also the staff training was also conducted at Central Prison, Mysore. Further, because of the lack of medical staff, the decision was taken to train volunteer prisoners. You can see many of the convicted prisoners who are educated wanted to contribute for the study. They were also involved in training. They were trained in psychological first aid and also gatekeeper prevention of suicide. And they were also taught to identify mental illness and to refer them. In the phase 2, there was an amendment done because many of the prison staff reported of mental health issues and also requested for assessment. Hence, the amendment was submitted and approval was taken. Prison staff were also assessed for mental health morbidity and 1 month extension was given for the study. And the ownership of the project was taken both by the judiciary and also by the prison. The prison department, both IG and also the superintendent of prison, participated and took the ownership of the project. At the same time, a drawing competition was held inside the prison. Many of the prisoners participated in the drawing competition. The first prize of the drawing competition became the front page of the report, which is available online. In the phase 3, the data entry was done, data analysis was done, interpretation of the finding, and also the guideline was developed. Let's look into the results of the study. This is the landmark study and also the report which was formed. And there was a executive summary was also made available along with a literature review of the prison mental health was also done. And the title of that report was called as Minds Imprisoned, Mental Health Care in Prison. So all the 3 reports are available online. Let's discuss about the results. Approximately 5,200 prisoners were there during the study. Occupancy rate was 248%. That clearly indicated overcrowding inside the prison. 65% were under trial prisoners, 4% of them were women. And during the analysis, we found that 80% of the prisoners had one or the other mental illness. If you removed the substance use, alcohol use, and drug abuse, 28% of the prisoners still had other mental illness. And approximately 2% had severe mental illness or required medication continuously. Urine screening was also done. Urine screening for drugs was done in 2 stages. In the first stage, to know the prevalence of substance use in the new entrant prisoners. That means who are newly arrested and brought to the prison, their urine was sampled and assessed for drugs. 45% of the new entrants showed positive for drugs. In that, 28% were using benzodiazepine, 17% cocaine, 13% cannabis, 4% amphetamine, and 1% each for barbiturates and opioids. In the second stage, we did urine screening for inmates who were there inside the prison for more than 1 month. The study revealed that the prevalence of substance use increased once they are inside the prison. There were 61% of the prisoners were using drugs. In that, 43% benzodiazepine, 31% cannabis, 15% cocaine, 9% barbiturates, 6% amphetamine, and 3% opioids. On comparing both the new entrant prisoners to the prisoners who are inside the prison for more than 1 month, you can see the use of drug patterns. The drug abuse increased from 45% to 61%. And also benzodiazepine abuse became rampant. Cannabis use increased. Number of substance also increased inside the prison. That means there is a high need for de-addiction centers to be started in each prison. That is very essential now, because the people who are abusing drugs, if they are not treated inside the prison, once they go out, again they will use drugs and they will be involved in commission of crime. Hence, there is an urgent need to start de-addiction centers in each prison. And if you look at the alcohol use, 44% of the prisoners reported that they were using alcohol almost daily and had a dependent pattern during the commission of crime. And 14% acknowledged that they were intoxicated when they had committed crime. And 4% reported of alcohol use in the last week inside the prison. That means even alcohol was made available inside the prison. Here I would like to make one point very clear. Generally, in any prison across the world, drugs are supplied either by the prisoners, either by the prison family members, or else the staff. That means there is no prison across the world where drugs are not available. They use various ingenious methods to supply or smuggle drugs inside the prison. At the same time, we also found depression being very commonest among the prisoners. 12% had past history of depression. 9% of the population of the prison suffered from depression when we did the study. At the same time, 2% had attempted suicide in the past 1 year. 7% had done deliberate self-harm. And during the study, 2 prisoners completed suicide, and it was an unfortunate event. Along with one of the prison staff also committed suicide during the study process. That is, during the 1 year period, we saw 3 completed suicide inside the prison. Psychosis was 2%. These are the people who require continuous medication, and the medicine need to be supplied continuously to the prison. If the prison do not get these medicines which are required, there will be relapse of mental illness inside the prison. If a one person inside the prison becomes violent, there is high possibility the violence becomes contagious and there will be prison riots. Hence, the medication need to be supplied for severely mentally ill patients. At the same time, we also came to know 15% of the prisoners had antisocial personality disorder. These are the people it's very difficult to do rehabilitation to them. They do very well in a structured environment. Once they are out, these antisocial personality disorder will yield to their impulses. It is very difficult to do the rehabilitation for this 15%. But however, I would like to emphasize on the positive side. 85% of the prison population can be rehabilitated, can be reformed, and they can contribute to the society. These results were disseminated across the country. And finally, these results played a crucial role in drafting Mental Health Care Act of 2017 with regard to providing care for prisoners suffering from mental illness. Section 103, subsection C of Mental Health Care Act of 2017 clearly says that minimum standard and procedure for mental health care services in prisons to be established. At the same time, a schedule was introduced into the rules of the Mental Health Care Act of 2017. It clearly says and also mandates screening for mental illness and substance abuse in the prisoners during the entry and periodic to be done, which has been emphasized in many of the Supreme Court rulings. Further, the Mental Health Care Act and also the rules mandates at least 20-bedded psychiatric facility for every 500 prisoners, along with establishment of telemedicine facility, availability of psychotropic medication, at least 24 oral medicine and 7 injectables were drafted, and they became the part of the schedule of the central rules. That means these essential medicines should be made available in each prison because the need for treatment inside the prison is very high. At the same time, one of the landmark judgment by the Apex Court occurred in 2019, that is Accused X versus State of Maharashtra. In this clearly, the Apex Court emphasized that Mental Health Care Act of 2017 was brought into force. The aspiration of the act was to provide mental health care facility for the prisoners. Hence, it is the obligation of the state to provide mental health care inside the prison. And also, it emphasized the state government are obliged under the Section 103 of the Act to set up a mental health establishment in the medical wing of at least one prison in each state and union territory. And prisoners with mental illness may ordinarily be referred and cared at the mental health establishment. So, even the Apex Court, within 2 years of passing this legislation, gave its ruling and mandated every state to implement this Mental Health Care Act in prison. Coming to the last part of my presentation, that is, mental health issues need to be solved inside the prison. What are those issues? The issues which are commonly seen and haunted for the prison staff are all such as deliberate self-harm, suicidal attempt, substance use and substance addiction, mental health problems like violence, sexual offenders, sexual offense, high-risk sexual behavior, aggression, violence, impulsive behavior, food refusal, personality problems such as impulsivity, antisocial behavior, violence inside the prison. Family and social reintegration after the release is a big challenge, vocational rehabilitation inside the prison, and continuity of care in the community once they are released. These are the challenges which need to be addressed. At the same time, this study did not implicate not only inside the prison, it is also applicable for juvenile homes, mental retardation homes, or else it is also called as intellectual disability now. So those homes need to be addressed, destitute homes, reception centers, detention center, social service complexes, beggary colony, and also rehabilitation for persons with mental illness. In these organizations need to be done actively. What are the recommendations? The recommendation of the whole study became a part of Mental Health Care Act. Now, they are not just recommendations, they are the law of the land. I would recommend, considering the mental health morbidity inside the prison, all national health program should run concurrently in every prison. That means none of the prisoners should not be devoid of national health programs. That includes National Mental Health Program, which needs to run inside the prison. Independent health system should be developed inside the prison. Invariably, in various states, the state health department lends their staff to the prison department. Invariably, these deputation is based upon punishment posting for the health staff to the prison department. Invariably, they do not serve any purpose at times. Many of the health staff are volunteers. They want to serve inside the prison. But unfortunately, we do not have good number of health care professionals who are trained in prison health. Hence, there is an urgent need to train the medical officers in prison health. Not only that, psychiatrists and other mental health professionals play a crucial role in providing mental health care inside the prison. The training of the prisoners in peer counseling, psychological first aid, and suicide prevention, that is gatekeeper training, should occur for the volunteers inside the prison. And also, we need to utilize the resources from the district hospital, medical colleges, NGOs, and other social service agencies to provide care inside the prison. There is a need for prison psychiatry to be developed, not only in the medical curriculum, and also national health programs need to be initiated in every prison. Adequate mental health professionals need to be recruited to provide mental health care inside the prison. There is a urgent need to provide family therapy, cognitive behavioral therapy, anger management, yoga inside the prison, to inculcate spirituality, and various other types of psychotherapy and group therapy needs to be started inside the prison. Because we are a social welfare society. Rehabilitation and reformation is the goal for the prison population. Without rehabilitation, these prisons are going to become university for committing crime. To conclude, my dear friends, there is high rates of mental health morbidity in prison population. Not only there, even the prison staff suffer from high rate of stress, burnout, and mental health issues. There is a need to assess physical and mental health status at the time of entry into the prison and also periodically in every prisoner. Independent health system needs to be developed for the prison department. And these are the various prison study reports which became the part of the project. This is the prison study report, executive summary, and also the academic literature review of Minds Imprisoned are available online free of cost. Thank you very much for giving your valuable time. Stay safe